Good morning, students. So today we are going to learn about peritoneum. So already this is peritoneum 2 class. Already I have learned the peritoneum 1 by Dr. Veshwar sir, where he has taught you about what is peritoneum and how to trace the peritoneum, horizontal tracing, vertical tracing. Okay, all those things are already taught. Then the next continued part of the peritoneum. So here we are going to study the spaces around in the peritoneum. Okay, there are a lot of spaces are there, so we'll go through that and we'll divide the peritoneum into different compartments. So before going to the topic proper, we'll start with the clinical scenario. So here is a clinical case study. A 45-year-old patient was admitted in the hospital with severe pain in the abdomen associated with fever and tachycardia. On palpation, the doctor found tenderness and guarding of the abdominal wall, and on auscultation, he noted the absence of vowel sounds. His pulse rate increased gradually, 1 to 2 hours of the observation. He was diagnosed as a case of acute peritonitis. So here, as you can see here, the case is a pain in the abdomen associated with the fever and tachycardia. So fever and tachycardia is there, and also the tenderness. Means what is tenderness? Tenderness is the pain felt uh, after pressing over the abdomen. That is tenderness, and also the guarding of the abdominal wall is there. Means the rigidity is there. So all these are in favor of something um, infection in the abdomen, especially in the peritoneum. Okay, and his pulse rate is gradually increased after 1 to 2 hours observation. So all these signs signs and symptoms show that it's the infection in the peritoneum, and as this is progressed acutely within a short period of time, so the diagnosis they made is acute peritonitis. You know that itis, that suffix means inflammation. So inflammation of peritoneum, which occurred in a very short duration. So that's why this condition, this case is of acute peritonitis. Okay. So with this background, we start with the topic. So already I've studied what is peritoneum and peritoneal cavity. So now we'll divide the peritoneal cavity into two main parts. Here you can see this is a sagittal section of the peritoneum. Okay, so here this peritoneal cavity is divided into two main parts. That is abdominal proper. Here is abdominal proper cavity, and this one is the pelvic cavity. So abdominal cavity and the pelvic cavity. You can just follow my cursor, okay, or the image. This is abdominal cavity. This is the peritoneal cavity. Further, this abdominal cavity is divided into supracolic and infracolic compartment. As the name suggests, supra means above. Above what colon? Here we refer here to the transverse colon. Here you can see this is the transverse colon. So above this transverse colon, this portion is supracolic compartment, and below the transverse colon here, this is the infracolic compartment. So we'll divide the abdominal cavity into supracolic compartment and infracolic compartment with relation to the transverse colon and mesocolon. In this picture also you can see here the anterior view of the abdominal cavity here. We can see this is the semicolon, transverse colon, descending colon, sigmoid colon, and rectum. So this is the sigmoid colon and sigmoid colon. So about this part of the abdominal cavity, this will be called a supracolic compartment, and below the transverse colon and transverse mesocolon, this portion of the abdominal cavity will be called as an infracolic compartment. So this is how you divide the greater sac into, okay, supracolic and infracolic compartments. So this supracolic compartment is subdivided by the reflection of the peritoneum around the liver into number of spaces called as subphrenic spaces. As the name suggests, sub means below. Below the phrenic means diaphragm. So here you can see this is the diaphragm. So just below the diaphragm, this is subphrenic space. And this infracolic compartment is divided by the mesentery here. Okay, So into two compartment, that is right infracolic compartment and left infracolic compartment. We'll study these compartments in detail in the further slides. And further in the infracolic compartment, you can see other two areas or the gutters around the colon. So in that you can see the right paracolic gutter. Para means beside the colon, beside the ascending colon, there is a gutter. The space is there between the abdominal wall and the um, ascending colon. That is called as right lateral paracolic gutter or simply right paracolic gutter. And just beside the descending colon on the left side, there is a left paracolic gutter, just lateral to the descending colon. Now we'll study the compartments. Supracolic compartment. Okay. Supracolic compartment. So this is also called as subphrenic spaces. In this compartment, mainly you see the subphrenic spaces just below the uh, diaphragm. So the below the diaphragm, there are six spaces are there in relation to the periphery of the liver. Here you can see the liver. So those spaces are called as subphrenic spaces. Sub means below, below the phrenic. Phrenic means diaphragm. So subphrenic spaces. These are of clinical importance, especially to the surgeon, because the pus gets collected in these spaces, and those pus collections will be called as subphrenic abscesses. So, what are those subphrenic spaces? So, we'll classify the subphrenic spaces here as intraperitoneal spaces and extraperitoneal spaces. Intra means inside, extra means outside. So inside the peritoneal cavity, those are called as intraperitoneal spaces, and outside the peritoneal cavity, that's called as those are called as the extraperitoneal spaces. So these intraperitoneal spaces further divided into four spaces, two on the right, two on the left, and and on each side, right or the left side, there are again two spaces. One is anterior, one is posterior. So the first one here you can see the left side, the left anterior subphrenic space, and just behind liver will be left posterior subphrenic space. And on the right side again, in front of the liver, that is the right anterior subphrenic space, and behind the liver, right posterior subphrenic space, which is also called as Morrison's spout, which is of a great relevance clinically. We will study that space later in detail. And extraperitoneal spaces, the right extraperitoneal space, the left extraperitoneal space, and midline extraperitoneal space outside the peritoneal cavity they are situated. These are in the supracolic compartment. Of these spaces, what just now I told you that there are three on the right side and three on the left side. Okay, out of the three on each side, two are intraperitoneal, one is extraperitoneal. The left, now we study each of these subphrenic spaces a little bit in detail. First, to start with the left anterior subphrenic space here, or left, which is simply called as left subphrenic space, which is lying between the left lobe of the liver. Here can be between the left lobe of the liver and the diaphragm. You see the left subphrenic space in front of the left triangular ligament. Already have studied in the liver. There is a ligament, left triangular ligament, right triangular ligament. Okay? So in front of the left triangular ligament, you will see this space, left anterior subphrenic space between the left lobe of the liver and the diaphragm. Then there is a left posterior space just behind the liver, and it is just behind and below the liver. That's why this is also called as left subhepatic space. Left subhepatic space. Sub means below the hepatic. In this region will be left subhepatic space. It is same as the lesser side, which you already studied in the previous class. The left posterior space is nothing but the left subhepatic space. It is nearly the lesser sac, already studied in the previous class. So I want to go into that detail now. Then right anterior space or right subphrenic space here, that is lying between the right lobe of the liver and the diaphragm. Okay, especially that is lying in front of the right side, the superior coronary ligament and right triangular ligament here. So the right anterior subphrenic space is lying in front of the right triangular ligament and superior coronary ligament lying between the liver and the diaphragm on the right side. That is between the right lobe of the liver and diaphragm on the right side. Blood aspect related to this, the infection may be spreaded into this space, and the infection can come from the gallbladder. Here you can see in this image, this is the green color, that is the gallbladder. From there, the infection can come from space, or else from vermiform appendix. Here you can see this is the vermiform appendix. So the infection also can come to this space in the lying down position, because here there is the right posterior subphrenic space, which is the most dependent area in the lying down position. Okay. So the infection can be spread even to this right anterior subphrenic space following the operations occurred in the abdomen. The next coming to the right posterior subphrenic space, subhepatic space, because it is lying below the liver, right posterior subphrenic space, or right, just you can call it as just the right subhepatic space. Okay, it is below the hepatic or the below the liver. That's also called as the Morrison's pouch or hepatorenal pouch, because if you divide the term between the hepatorenal means it is lying between the liver anteriorly and kidney posteriorly. So that's called as hepatorenal pouch or right posterior subphrenic space or Morrison's pouch or just right subhepatic space. All these are synonyms. So it is lying between the right lobe of the liver and the right kidney and the right colic flexure. Here you can see this is the right colic flexure. This is also called as hepatic flexure. So this is the region where the right subphrenic space or the Morrison's pouch is present. This can be asked as a short note, so this is important. So we'll study the boundaries of the hepatorenal pouch. Boundaries anteriorly you can see here. This is the hepatorenal pouch. This is the sagittal section of the peritoneal cavity where you can see the liver here, the gallbladder, the kidney, suprarrenal gland. This is the hepatic flexure. Okay, this is the peritoneal cavity. Okay. So anteriorly, this is the hepatorenal pouch. So anteriorly, the inferior surface of the right lobe of the liver and the gallbladder situated anterior relations. Okay, here also you can see liver anteriorly situated, and this is the Morrison's pouch, and behind is this one kidney and the hepatic section. So what are the posterior boundaries? The posteriorly you can see the upper part of the kidney here, and above the kidney you know that there is a gland called as the right suprarenal gland above the right kidney. Then the second part of the duodenum, here in the lower picture you can see the second part of the duodenum makes the relation. Okay, here this is the picture where this side is the anterior and this side is the posterior. So this the posterior relations are like once again the kidney, okay, and the second part of the duodenum, and also the hepatic flexure of the colon, and also the transverse transverse mesocolon, and part of the pancreas. These are all the relations on posterior relations to the hepatorenal pouch. Then superiorly, there is an inferior layer of coronary ligament, inferior layer of coronary ligament that makes it the superior relation to the hepatorenal pouch. And inferiorly, the cavity is open. Okay, this peritoneal pouch is open to the peritoneal cavity. It is open to the peritoneal cavity. And to the left, you can see this is the right side, this is the left side. This is the anterior view of the abdomen. After cutting the anterior abdominal wall, you are seeing this thing. So this here is the peritoneal hepatorenal pouch. You can see here the kidney is there, the renal, and this is the hepatic, the liver. So this space is the hepatorenal pouch. So to the left side, this pouch is communicating to the omental bursa or the lesser side through this foramen, uh, the epiploic foramen. And to the right, it is limited by the diaphragm. You can see this right side is limited by the diaphragm. These are the left and the right boundaries of the hepatorenal pouch. What is its importance? Hepatorenal pouch, you can see in the lying down position, if there is an abscess occurring in the abdominal cavity, the abscess comes and gets settled here in the hepatorenal pouch, lying down position, when the patient is in supine position. So this is the lowest part of the peritoneal cavity. Coming to the infracolic compartments. Infracolic compartments, as I said before, this is divided into right and left infracolic compartments. We start with the right infracolic compartment. It is lying between the ascending colon on the right side, okay, and on the left side there is a dysentery, and above there is a transverse colon. So it looks like a triangular shape with the apex facing downwards. So it is lying between the ascending colon, transverse colon, and dysentery. It is forming a triangular space where its apex is directed downwards. The left infracolic compartment is lying between the descending colon and the mesentery and the mesocolon. It's also triangular in shape where the apex is facing upwards, and inferiorly it is freely open into the pelvis or the pelvic cavity. This is left infracolic compartment. Then, as I said before, in the infracolic compartment, you will see two gutters just besides the ascending and the descending colon. The right side, right paracolic gutter lying just lateral to the or right to the ascending colon. It opens freely into the hepatorenal pouch above, and whereas so this space gets infected by the downward spread of infection from the hepatorenal pouch. So the infection from the hepatorenal pouch can go up to the pelvic cavity while passing through this right paracolic gutter. In that, even this paracolic gutter can also get affected. You can see the arrow mark here. That is the spread of the infection from above downwards in the standing position or in the um, standing at position. The infection can spread downwards, and also from the appendix also the infection can come to this space in the lying down position. Coming to the left paracolic gutter here, we just follow the cursor. It is open freely to the pelvis downwards, and above it is separated from the spleen by a ligament called as peritoneum ligament, which separates the spleen from the left parabolic gutter. Okay, so the spleen and the linear space are separated from the left parabolic gutter by the peritoneum ligament. Here you can see peritoneum ligament. So here you can see the direction of the fluids, if at all it is collected in the peritoneal cavity, the direction in the line of position. It can, from the right side paracollicular, it can go to the right subfield space, and from the left side go to the left paracollicular from the pelvic cavity. There are some pouches or the recesses in the abdominal cavity. In the male, you can see this is the lower part of the abdominal cavity in the pelvis. Pelvic cavity. So here this rectovesical pouch, as the name suggests, rectovesical means it is the rectum and the vesicle. That is, vesicle means the bladder. So in case of male, there is a rectovesical pouch because in female there is an additional organ here, that is the viscera. Okay? That is the uterus, which is not there in the male. So that's why there is only one pouch, that is rectovesical pouch. Whereas in females, between the rectum and the uterus, there is the rectouterine pouch, which is also called as pouch of Douglas here. And between the uterus and the bladder, this is called as vesicouterine pouch. This picture is the lateral section of the pelvis. These two pictures. So rectouterine pouch is a important question for your exam. So please study this in detail. So rectouterine pouch is also called as pouch of Douglas or Douglas's pouch. Here you can see between the rectum and the uterus. This is rectouterine pouch. What are its boundaries? Anteriorly, you can see here the uterus and the posterior fornix. The posterior fornix of the vagina. Vagina has got fornices, the plural term of the fornix. It has got anterior fornix, posterior fornix, and two lateral fornices. So between the posterior, here is the posterior fornix of the vagina. So this space is related anterior to the uterus and posterior fornix of the vagina. So here is the uterus, this is the vaginal canal. This is the vaginal canal. This is the anterior vaginal wall, this is the posterior vaginal wall. So here is the posterior fornix. So the posterior fornix and uterus, they are formed in an relation to the rectouterine pouch or the pouch of Douglas. Posteriorly, the relation is the rectum. Okay, the rectum here. And inferiorly, there is a fold of peritoneum, which is called the rectovaginal fold between the rectum and the vaginal What is important? The rectoid pouch or the pouch of the glass. It is the most dependent part of the peritoneal cavity. And the body is in upright position. When the body is in upright position, you can see whatever the infection is there above anywhere in the abdominal cavity, that infection comes and gets settled in this pouch of the glass because of the gravity. So this is the most dependent part of the peritoneal cavity when the body is in upright position. Or even in the supine position, it is the most dependent part of the pelvic cavity. Whereas in supine position, most dependent part you can see here is the hepatorenal pouch. That is the abdominal cavity. Whereas in the pelvic cavity, the most dependent part is pouch of Douglas in the supine position. Please remember that. This is important for your MCQ. So once again, you can see the direction flow of the flow of the peritoneal fluid in the abdominal cavity. So even from the pelvic cavity, okay. So the infection can go to the suffering spaces, and in the upright position, the infection can come to the pelvic cavity. So in the upright position, which is the common area where it is collected, it is pouch of the glass in the upright position. Whereas in the lying down position, the first collection is usually seen, commonly seen in hepatorenal pouch in the abdominal cavity, and in the pelvic cavity, it is in the rectoid pouch. There are some folds and recesses in the posterior abdominal wall. You must need to study around the duodenum here. So here you can see the fourth part of the duodenum and the hepatoduodenal flexure. So the duodenal jejunal flexure, the duodenum and jejunum, so it's the duodenal flexure which is suspended by the ligament of Fritz. So surrounding the duodenum there are recesses here. Just above the duodenum there is a superior duodenal recess, okay, and the fold. And below it is the inferior duodenal fold and the recess. And besides the duodenum there is paraduodenal recess. So that has got a clinical importance because near this paraduodenal recess there is a vein called an inferior mesenteric vein. The surgeon has to take care during the operations in these regions. He should not cut the inferior mesenteric vein by mistakenly. So he has to take care of this. This is the clinical importance of this paraduodenal recess. And just beside that, just behind the duodenum, there is a retroduodenal recess. Retro means behind the duodenum, retroduodenal recess. And between the duodenum and the jejunum, there is a duodenal jejunal recess. Yeah. And there is another recess missing to parietal recess that is not shown in this picture. Then there are some recesses around the sigmoid mesocolon. Here you can see this is the descending colon, this is sigmoid colon, and this is sigmoid mesocolon. Around the sigmoid, there is an intersigmoid recess, which is uh, looking like an inverted V-shaped recess, which is seen around the attachment of the sigmoid mesocolon. Just remember these some of the recesses. And around the cecum, here you can see this is ascending colon, this is the cecum, and here is the appendix, and this is the ileum. Okay, so this is the iliocecal junction. So around the cecum, just behind the cecum, there is a retrocecal recess, and just above the ileocecum, see this is ilium, this is cecum, so iliocecal junction. Above that iliocecal junction, you can see the superior iliocecal recess here, and below the iliocecal junction here, you can see the inferior iliocecal recess. So this is superior iliocecal recess, this is inferior iliocecal recess, and this is retrocecal recess. There are some other aspects related to the peritoneum. One is ascites. There is a fluid collection occurring in the abdominal cavity, that is the peritoneal cavity. If there is a fluid collection occurs, that is definition is called as ascites. Pneumoperitoneum, as the name suggests, pneumo means air. The air collection is there in the peritoneal cavity, that condition is called as pneumoperitoneum. Hemoperitoneum, if there is a blood collection in the peritoneal cavity, it's called hemoperitoneum. Peritonitis, you can see the prefix word itis, and the suffix is the peritoneum. So there is if there is an inflammation of the peritoneum, that condition is called as peritonitis. Because of the inflammation of the peritoneum, you know that the peritoneum has all the visceral layer and the parietal layer. Parietal layer is pain sensitive, and because of the inflammation, the surrounding muscles also in this peritonitis condition, you see the rigidity of the abdominal wall, anterior abdominal wall. So there will be guarding of the abdomen. So there are some clinical aspects related to the peritonitis. Paracentesis. This is the we make a opening in the abdominal cavity to drain out the excessive fluid in the ascites case. That condition is called as paracentesis. Laparoscopy. Scopy means you will introduce the scope into the peritoneum, into the abdominal cavity. This is the surgical procedure done to operate some of the organs in the peritoneum. So you must have heard the appendicectomy, removal of the appendix. It is done either the open surgery, where the surgeon will cut open the abdomen surgically with his skills, hand skills. And whereas the laparoscopic surgery means they will use the laparoscopic instrument, they make holes on the abdomen, three holes, and they will through the with the help of the um, camera and light source, they'll cut upon the abdomen through the holes, and they will do the procedures. For example, cut the appendix and take out in case of appendicitis, acute appendicitis. So that is the laparoscopy. Laparotomy. This is again the cutting open of the abdomen as well as the laparotomy. And peritoneal dialysis. You must have heard the word dialysis. It is done to when the kidneys are going to the failure conditions or kidneys function is not well. That time you need to, because the function of the kidney is to filter the blood that is not occurring well. So you have to filter the blood with the help of a dialyzing machine. And there are two types of dialysis, that is hemodialysis and peritoneal dialysis. So in the peritoneal dialysis, they make use of this peritoneal cavity. So they will introduce the dialysate, the solution which is used in the dialysis, and that will go into the abdominal cavity, the peritoneal cavity, and through the peritoneal cavity, the blood is getting filtered because the you know that the lining of the peritoneum is mesothelium, which acts like a filter and it will filter. So we can use the peritoneal dialysis, okay, to filter out the blood. So this is peritoneal dialysis. Okay, usually it is done for the as a continuous ambulatory peritoneal dialysis. Means in the less critical phases where the patient wants to be ambulatory, means moving condition. So that time this is offered. So this is, at least you remember the word peritoneal dialysis. Okay, you can see here in this patient. So he is ambulatory, so we can this dialysis can get done in the home without going to the um, hospitals. Okay, so just remember this is peritoneal dialysis. But most of the dialysis which are done in the hospitals are the hemodialysis. Okay, the blood will be going to the dialysis machine and to clean and the the filtered blood is again going back to the body after passing through the machine. That is hemodialysis. What here we are referring is the peritoneal dialysis. And other aspects are like subphrenic spaces, abscesses. So in the subphrenic spaces, if there is a collection of the pus, and those are called as subphrenic spaces. Like here you can see the left side left subphrenic abscess, the right side right anterior subphrenic abscess, left anterior subphrenic abscess, and if there is abscess in the subhepatic space or the right posterior subhepatic space, which is also called as Watson's pouch, that is the right posterior subhepatic abscess. And sometimes even the left posterior subhepatic abscess can occur just behind and below the left lobe of the liver. These are some of the aspects related to the peritoneum and the spaces around the peritoneum. So I will give you some the assignment here. There are five MCQ questions. I will read those questions. Please note it down on a paper. Okay, and write the answers in the separate um, sheets like 1, 2, 3, 4. The A, B, C, D for the questions and answers. For example, here the first question is MCQ. I read out the question. Select the incorrect statement about the peritoneum. First option, it is the largest serous membrane in the body, lined by endothelial cells. B. C. In males, it surrounds a closed sac, the peritoneal cavity. D. In females, it surrounds a sac which has two openings at the ends of uterine tubes. So you write in the answers. Okay, that is first question. Answer is whatever A, B, C, D. You write it like that. You write the answers for all the five questions, and later you can submit the answers to my personal WhatsApp number. So that is like a attendance for you, and the and you correct yourselves. Later, once this class is over, after an hour or two, I will send the answers in the group, so you can correct by yourselves. So for each question, 1 mark, so you can score yourselves how many marks you have got out of 5, and you write the answers to these questions and the marks, and you will send it to me. So it is an assignment work, and please be honest with yourselves. Don't just share the answers with your friends. These are simple questions, so there should not be any problem. These are the questions related to peritoneum 1 and 2 class altogether. Okay. Second question regarding peritoneum, all the statements are correct except it forms the innermost layer of the abdominal wall. It is composed of mesothelial serous membrane. It is insensitive to pain. It develops from somatophoric mesoderm. Third one, the epiploid foramen of Winslow is bounded by caudate lobe of liver superiorly, first part of duodenum inferiorly, portal vein posteriorly, right free margin of lesser omentum anteriorly. Fourth question. All are retroperitoneal or extraperitoneal organs except kidneys, suprarenal gland, spleen, descending on. Please write the correct answer, one correct answer to these questions. Fifth one, lining of the peritoneum is called as endothelium, mesothelium, epithelium, or all of the above. So please choose one correct answer. So with that, we have come to the end of the class. Have a nice day. So if you have got any queries, you can message me personally on the WhatsApp number. Okay, your queries, and please submit this assignment. Okay, once I give you the answers, and you on the top of the page you write your roll number, your name, and write the answers like question number one, what is the correct answer? A, B, C, D. Like that, you answer for all the five questions and you submit it to me. Okay. With that, we have come to the end of the class. Have a nice day. Okay. Thank you. Have a good day.